During my nursing student years, I didn't have any placement in ED, so I sort of just fell into it. Whenever I qualified, I worked in fracture clinic. It was around that time that the charge nurse there, he was very insistent that there was a lot of peer teaching, and on a daily basis we would have had peer teaching. And I think that's where my love of ongoing professional development started. And a job came up at Ulster University and I applied for that. And part of the condition of that was that I continued and finished my Masters. Well, I feel research is important in any area of nursing. I suppose ED is my area of interest, and that's where I have conducted research. As part of my Masters, I looked at the emergency nurse practitioner role and how it relates to advanced practice. And for my doctorate, I'm looking at person-centeredness in emergency care. So I suppose that is where my passion lies. But I feel research is very, very important, because really clinical practice should drive research, and research should underpin all aspects of clinical practice. But I think we all need to be aware of how to critique research, how to apply it to our practice. And I think there needs to be more opportunities in practice for ED nurses to avail of critiquing research, discussing it together, decide if that is something that is relevant to them. How should that structure our practice? How should it change our practice? Are we doing things properly? Because there needs to be an evidence base that underpins all that we do in nursing. And I think that we as ED nurses are in the best place to do that. And I think that's an area that we could really shine at. I work hard to try and keep my skills up, maintain my clinical credibility, and I would do shifts when possible. So I'm very fortunate in the things that I do teach are very relevant to my skills and experience in the past. I really enjoy the opportunity for curriculum development as well. It means that we would work really hard at Ulster to try and make sure that our courses are relevant to practice. We would want to make sure that what we provide is best.